Okay, we're going to be taking just a couple of tissues. We want brain, heart, swim bladder, and gonads. So first for the brain, we feel behind, towards the back of the skull. Make an incision. Just real quick, cut the spine. Make an incision along the skull. Kind of cut away some of the skin and muscle here. Scrape away the muscle so we can get down to the skull. Now this is a little bony ridge right here. We're just going to kind of scrape it up. The brain is sort of right below that. It'll give us better access. We'll take the bone crushers, peel back the skull, see the brain sitting there in a little pocket. This is the hindbrain down here. I think we have enough access now. We're just going to cut all the nerves around the brain. So that we can pull the brain out. This is the hindbrain connects to the main nerve bundle, to the spine. These nerves along the side here. And these in the front are the optic nerves. And there's the brain. Make sure we got the pituitary. Alright, next is the heart. So I'm just going to put that here to get any liquid that comes out. Flip the fish. And the heart is up here in the throat area. I'm going to cut through the muscle under the jaw. You see the heart is still beating there. Put some retractors in here just to get the flesh out of our way. And up this clearish part at the top is the bulbous arteriosus. That's where we go in with the needle when we are doing a gill perfusion. We come in, when we're doing a perfusion, we make a little incision here in the ventricle and then stick the needle up into the bulbous arteriosus, and then we can insert a push through a fluid like saline or PBS and flush the blood out of the gills. But we're not doing that today, we're just taking the heart. Okay, so we have the heart, and then this is the atrium, and the ventricle, and the bulbous. Alright, next is the gonads. So I'm looking for the gonads. This is the liver. And the intestines, which are full. Urinary bladder. This was the bladder right here, intestines, and then this is one of the testes. So we're going to take that. So here we have one of the testes out. Some yucky stuff on it. I'm just going to remove before we save it. One, and we'll move the intestines out of the way, and then you can see the other one is sitting right here. There it is. Alright, and then the last thing that we need today is the swim bladder, which you can see right here, and it's full of air. Toadfish live on the bottom, so they don't really use their swim bladder for buoyancy, but they do use it to make noises, make little croaking noises. And it's getting pretty yucky in here. We cut through the intestinal wall, so those are leaking out. Squid guts and ink everywhere. all those guts in our tissues. So try to wipe it off a little bit. And then we have to deflate the swim bladder. So all we do is just go like that, and it deflates like a balloon. And that's all the tissues we need for today.